Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I always like to educate people about the value of phase one or early treatment. So this is Kincaid, and we saw Kincaid when she was about 9 or 10 years old. And, Kincaid had some spaces between the upper teeth. I'm not concerned about those upper spaces at this point. Now, if the family was concerned about the aesthetics here, we could do treatment to resolve the aesthetics and to make the smile look better. But that was not the issue. Here's a close-up of Kincaid's teeth. You'll notice that we like to have all the upper teeth to the outside of lower teeth. And so there's one tooth over here on her left side, the right side of your screen, where the upper tooth is to the inside of lower teeth. And we call this a crossbite relationship. I'm actually not that worried about this crossbite relationship because this is a crossbite relationship of two baby teeth. And so I don't think that this says a whole lot about jaw discrepancy or the sizes of her jaws. It's not going to affect the growth of her jaws to have this crossbite relationship. But this is actually why she was referred to us, was for this crossbite relationship. Here's a look at Kincaid's upper teeth. And I think this is a pretty good upper arch. Again, we have some misalignment of some of the front teeth and we have some spacing. So it may not be the most attractive set of upper teeth, but there's really nothing wrong here and no reason to treat based on what you see in this picture. Here's the lower teeth. We have a little bit of crowding of the lower front teeth. Again, I don't get too worked up over this amount of crowding at this age. We know that some baby teeth like this one and this one are bigger than the adult teeth that replace them. So we know that we're going to gain space for all the adult teeth to be straight in the future. Okay, so why did we treat Kincaid in phase one? Well, if you look here, you may notice that there are two upper canine teeth, these two teeth, that are a little out of place. So they should be pointed more directly into the mouth. They should be replacing this baby tooth and this baby tooth over here. But especially this tooth on it's her right side, the left side of your screen, is really coming in at an angle. It's overlapping completely the lateral incisor root, so the adjacent tooth root. In worst case scenarios, these teeth can come further towards the middle and they can actually begin to damage the roots of the incisors, rendering the incisors hopeless in the future. So that's the worst case scenario. We certainly want to avoid that. But our job here, remember, in phase one treatment is to make sure that all the adult teeth can safely come into the mouth. And so this is a situation where we want to make sure that we get these canines into the mouth. So we have a couple ways to try to get canines into the mouth without surgery. You can do palate expansion. You can make the upper jaw bigger. You can consolidate space to where the canines belong. You can extract baby teeth. But sometimes it's just worth going ahead and jumping into a surgical rescue of these teeth. And so that's what we elected to do after consultation with the oral surgeon. We elected to just go ahead and do the procedure. They were going to have baby tooth extracted anyway. So this baby tooth was going to be extracted anyway. And the family elected, hey, let's just go ahead and make sure that this tooth comes in. We don't need a second trip potentially to the oral surgeon. I was fine with that, especially because this upper right canine tooth is completely overlapping the lateral incisor root, beginning to even overlap the central incisor root based on the x-ray. So I had no problem with go ahead and rescuing this. So what did we do? We added some braces. We pushed the front teeth together. We consolidated space where the canines belong. And we sent Kincaid to the oral surgeon. She had the baby tooth extracted. She had a gold chain that was placed up to the adult tooth. And we used that gold chain to help guide the tooth into the mouth. And here we are at the end of treatment. It took almost a year and a half. But that tooth is completely in the mouth. And strangely, the tooth on the other side, which is actually in a much better position, is not yet in the mouth. So you can see how extraction of the baby tooth and bringing the adult tooth in really expedites bringing that canine tooth into the mouth. So at this point, we've completed our phase one treatment and things are looking really, really good. Here's a picture of her upper teeth. There's the canine tooth that's now in the mouth. That's in her upper right. And the upper left, this is still a baby tooth. And you can see that I left some extra space around the baby tooth. That extra space is there because the adult canine is bigger than the baby tooth. So we leave extra space to make sure that that canine tooth can come in. And here's a picture of Kincaid's smile. So we went ahead and got the smile touched up while we're at it along the way. We were not involved in Kincaid's mouth to give her a better smile. But if you're going to use braces to bring the canine tooth in, you might as well make it look good too. So we get the added benefit of having a nicer smile, and it couldn't happen to a nicer girl. So thanks, Kincaid, for being a great patient. So happy that this was a great phase one treatment for you. And we're really excited that you have this new smile.